Well, you may not have heard his name before. I've heard his name a lot, and I think you will be seeing some exciting things if you want to know what's happening with Broward Health and the foundation. You know, foundations are interesting animals in a sense. They are the ones who kind of sit in the background, and they make things happen so that the hospitals can function. And the person who's the president and CEO of the Broward Health Foundation is Dennis Stefannaci. And Dennis is a go-getter beyond anything you'll ever meet. So, Dennis, thank you very much for coming and for allowing me to be on the board of the foundation, because it is one fantastic group of people. And I know that you've been involved in making sure that it went from, I don't know if it was 7 to 25 or 28. And I am amazed at what you've been doing.
Well, thank you, Nita. That's where we're thrilled, obviously, to have you on the board. It's a great time to be at Broward Health as a system, as well as at the foundation, because there are many, many exciting things going on. Not only is the system itself growing exponentially as it serves the community and the programs it's developed across all hospitals, but the foundation as well is growing in leaps and bounds, just as you've said. We really are premised on the concept of strategic philanthropy, so our primary role as we serve the system is to take projects that the hospitals have that need to be supported financially, and to make connections between donors and those programs who have an interest in the kind of programs that are being offered, and to make those reality. So in addition to the funding that the system supports, to all the hospitals, they support their capital budgets. We, in fact, also have been very instrumental over the last 3 years in underwriting major expansion programs entirely with philanthropic support. So we're excited to be here.
You know, Dennis, it's interesting as you're talking, and these are a lot of good words, but until you actually go to a hospital and really see what happens at a hospital, and some people have their favorites, whether it's the Broward General or Imperial Point or out at Coral Springs or North, you don't really understand how that room got paid for, or how those doctors are even there, or the wall of donors and all their names and what do they do. So I think that I've learned a lot just in the short time, but maybe what we need to do is go through the hospitals and talk about each hospital has a particular specific goal, and maybe we could go through that.
Oh, that'd be terrific. I'd appreciate having the opportunity of doing that. Let's start with Broward Health Medical Center. Over the last couple years, the programs that the foundation have been actively engaged in underwriting that is an extension of how that hospital serves the community are really several. One has to do with the Comprehensive Cancer Center. We have raised $1.8 million to renovate the outpatient adult infusion center. We've raised another $1 million to complete the renovation of the Comprehensive Cancer Center there. Another $250,000 to underwrite the expansion of and renovation of our hospice program that's physically housed at Broward Health Medical Center. And we're now actively engaged in helping the hospital in a major renovation to serve women and children. Over the last 2 years, the system itself has stepped forward in support of Broward Health Medical Center in the area of women's and children to do two things. One is to completely renovate its maternity program, changing all those rooms into private rooms. That was a $22 million renovation project. And then the next step in that was to renovate our children's hospital that it hasn't been renovated for a long period of time. That's a $52 million project. The foundation will be involved in that in some way. We're working on all the plans for that right now.
But I'm just going to stop you a minute, because since I've been involved, I know so much more. Now, we say the children's, what we're going to do there. And I saw these at the big ball that you raised so much money, where children, little babies, are sitting, in their mother's arms, and maybe they're sick or something's happening, and then right next to them is another baby. I mean,
right.
There's no way for them to be separated with the family members. So that's a big opportunity.
Right. And the renovation, as I mentioned, is a $52 million project. And in fact, $21.5 million, or 41% of that entire renovation project, is for the renovation and expansion of the NICU unit, the neonatal intensive care unit that you were talking about. Anita mentions here that our unit, we have a level 2 and level 3 being the highest neonatal intensive care that's provided. All of that exists. There are 63 incubators on one floor, so it's one big ward, essentially. So what happens is, as Anita just mentioned, is you have a parent who has a child who's in crisis sitting right next to another parent who may also have a child who is in crisis, who probably does if they're in the NICU unit, and there's no privacy, there's no room for the family, there's no room for them really to support that very important time when when their child's life is at risk. So what's going to happen in this renovation is we're taking the one floor that's a ward essentially, and creating 2 separate floors, all with private rooms. So we will now have 63 private rooms, so that with nurses' stations in appropriate places. And what's kind of interesting is in the level 2, which is still severe but not as severe as level 3, the floor itself will have several nursing stations, like most critical care floors, where they can actually see what's going on. But level 3, which is the most acute care that's delivered for neonates, the nurses, there'll only be 2 nurses stationed, because the nurses will spend all of their time outside all of the rooms. And the rooms are created in such a way that there are 2 private rooms that come together, and there's a nursing station between the 2 of them. So the care will be as good as the care is today. And I think you could look across all of our hospitals, and we deliver the highest level of quality of care, the greatest nurses' care. We have tremendous physicians. What we don't have is a real good environment that lends to healing. So this project will help do that, as of all the other projects at Broward Health Medical Center. Many of us still call it Broward General. That's how most people will remember it.
So for those of you who are listening to this and you're saying, oh, that's wonderful, how can I help? Well, you can help in a lot of ways. Sure, they need volunteers. They need a lot of things with Broward Health. But what we really need would be donations. And a lot of you, of course, if you have made out your wills already, or you're thinking of maybe making a donation, no matter what amount it would be, it'd be great for you to really consider the Broward Health Foundation. And through that, through calling, and you'll get some wonderful people who will talk to you. Let's see. So the website for us, and I'm going to tell you right now that the way that you can get into this so that you can make that donation would be browardhealthfoundation.org, browardhealthfoundation.org, or you can call 954-712-3980, 954-712-3980, because there's nothing better than knowing that you have made a difference, and it's almost like becoming immortal, because long after you're gone, something stays. And maybe before you go through the other hospitals, let's just take a quick thing for what donors are going to get, besides a good feeling, this wonderful art program about the wall of donors.
Thank you for bringing that up. We are very excited about a new project that's coming online to recognize the generosity of those who choose to support, whether it's Broward Health Medical Center or one of the other hospitals, but the system in general. And over the last year, as Anita knows so well, over the last year, I've been working with 2 artists who really are the curators at a place called Fat Village, which is Flagler Art and Technology Village, which is in Fort Lauderdale. It's on the northwest side of Fort Lauderdale. And we've been working on trying to find a way, or creating a program, if you will, that with art will connect philanthropy with the work of the actual hospital, and using technology to parallel the technologies of the hospitals today in a special way that will engage people when they come into the hospital environment. So next year, July of 2015, we will be installing in each of the 4 hospitals very, very different donor walls that are pure reflection of artistic talent, technology, thoughtful interaction between those in that hospital environment and the people who are supporting it, and making a visual and very important connection between how the community is supporting these hospitals and the number of people it supports on an ongoing basis. So we're particularly excited about that. We believe that it will become an example that will be carried across the country. It's a very different way to look at donor recognition. Most often in most organizations, whether a hospital or university, they have donor walls that recognize cumulative giving. They're walls that stay in the same place. These will be very different. These will actually move the names, move them around the lobby area. The motions will control them. The motion of the individual will control them, and again, it'll help people understand through this technology and art the important relationship between philanthropy and the support of that organization and the number of people it serves annually.
I think the what you just said is just extraordinary, because that's it. It's why all these people who are donating should not only have their name on the wall, but they should be in fluid action, doing something, because that's what their money was given for. And as you just said, Dennis, also, I've been involved in a lot of things where you see the walls. Sometimes you have to go down low to see the names, and they're just there. This is really going to say, listen, guys, because you did this, we're here.
That's right.
And I think it's going to encourage other people to donate also. Okay, well, I'm glad that got done, because you're going to be hearing more about that. But my guest is Dennis Stefannaci, and he is the president and CEO of the Broward Health Foundation. And we're talking about the hospitals. Well, I have one of the hospitals, and I know I shouldn't have favorites, but the one at Imperial Point is one I'm very closely allied with, and it is absolutely so caring. They do so many things there that go out of your way. I mean, I even walked in. This is rare. I walked in. I didn't know where the meeting was, and someone could have been the janitor. I don't know who it was. Said, "Where are you going? May I help you?" And just help me. And then just didn't point in the direction. They walked with me till I found the place.
Well, Imperial Point is, as we were talking about a little earlier, Imperial Point is probably the most boutique hospital in the system. And it really is, as Anita has just mentioned, I was thinking of Alice Taylor, who is the CEO.
Let's talk about Alice Taylor. Yeah. She's a great woman.
She's the CEO of Imperial Point, Broward Health Imperial Point. But it's a very unique place because it really has a very special feel to it. And today it's created a program. One of its major areas of specialization today is men's health. We always hear about women's health, and all of our hospitals specialize in women's services, some in women's and children. But Imperial Point's major program, one of its major programs and unique programs, is its men's health initiative. Because and as part of that, they have probably the most unique service delivery system, at least in South Florida, and maybe in the whole state of Florida, maybe beyond that, because we have a man van. Unlike the mammography van, this is a man van. And what it does is travel around the county, stops at several different places, and does testing for men's health. As we all know, men are very hesitant to have testing done. They don't want to go to the doctors, and for the most part, the services that are delivered to men really happen because of their wives or spouse or significant other really forcing them to do this. So what the man van does is it really takes that testing to the workplace or to the community church or wherever it's contracted with, and they deliver all the services at that particular site. So it's a very, very unique program, and we have. Over the last year, it's only been in existence a year. It's been, highly received, very well received across the community. And, the intent, like with the mammography van, the intent is to be able to identify early on maladies that may be life-threatening later on. And when those, through the test, when those kind of things are discovered, to connect them with the right people, the right physicians at the right facility, so that they can deal with that issue before it becomes critical or it becomes life-threatening at a longer period of time.
And so I'd like the people just listening, if you have an organization or you have some sort of community or you're going to have a fair or a festival, why don't you call and ask? They'll bring the van there, and it's a beautiful van. So it's something that we hope you'll do. You can just call the Broward Health Foundation at 954-712-3980, or you can go to browardhealthfoundation.org and ask for the man van.
That's it.
And it'll come.
It'll come to your space. They're always looking forward to do it. Another one of our hospitals, if I might, which is Broward Health North, which is our hospital right off of 95 and Sample Road, the second largest hospital in the system. Has been around a long time. And for those of you who pass 95 and see it on Sample Road, you see it's an old, tired facility. Well, the good news is there are some major changes happening. We will be actually in June, at the end of June, doing a groundbreaking ceremony at Broward Health North, and we are going to begin a $70 million renovation of that facility. It'll take a number of years to do, but not only will that really enhance the infrastructure, replace the infrastructure that's been there for a long, long time at that hospital and create more private rooms, but probably the most unique thing about this renovation is we will rewrap the whole building, so the whole building will have a new facade. It's like putting a skin on the outside of the current building that's there. It will look nothing like the building that exists, but the old building will still be inside, but the whole building will be wrapped. And then the foundation, in addition to supporting that work, the foundation is really going to next fiscal year for us, which will be after July of this year, begin a program to raise $2.5 million to create a neurological institute at Broward Health North, which for many of you know deals with Alzheimer's and memory disorder, pain, spinal issues, anything that has to do with the neurosciences of the body. Broward Health North, that's probably what it's most known for. It's a program in neurology. It has the best neurologists in this area. The best equipment it has all of the state-of-the-art equipment. So what this neurological institute will create for it will bring those pieces together, create its own entrance, and really bring the visibility to the importance of that program to the community. So that's another project we're really excited about.
Well, and what you don't know is, maybe you don't know, but I brought my mother what's called the Broward Memory Disorder Center. Mm-hmm. I brought her there to have her check to see what was going on with my mother's problem. And Dr. Todd, who's been there a long time. And
everybody knows Dr. Todd.
Dr. Todd, but also Shelley has been there a long time. And I was very involved with that organization long before I knew you. And the only problem I had was they have to change the name because I told my mother it was the Memory Center. You're going to get a better memory, not the Memory Disorder Center. But I'm so glad you're doing that. That is so important. And you're right. So many neurological problems now with Parkinson's and things like Alzheimer's. So that is a major focus. I'm glad you're doing that.
We're excited to be involved in that. And, that's another example of the hospital, when it looked at it, the needs beyond wrapping the building and changing the infrastructure, realized that it could better serve the community if, in fact, it created a neurological institute. And they came to the foundation, and we, as part of our strategic plan, adopted that as one of the programs that we would support, and we will begin a major effort to underwrite supporting for that, to look for financial support of that project.
Yeah, so people can really realize as you look at the hospitals over the next 5 years, you're going to see something marvelous and very different, and your money, the money from the county, all the money that, donations, this is where we have to go with the health. We need to provide good health, excellent health rather, for the citizens, and this is how it happens. It doesn't come from the sky, and everybody's got to jump in, and they need volunteers, but they also need donations, and we appreciate everybody who does good things at all the hospitals. So let's keep moving along. I know that there's something very, very good at Carl Springs. I mean, right. I love, there's a wonderful story about Lisa
Picard.
and what she's going through. I mean, that has so much heart. You just can't hardly talk about it.
Yeah, Lisa Picard, for those of you who don't know, is a cancer survivor. Actually, she's been fighting cancer for 19 years. And it's miraculous, her stability or her ability to recover, because Lisa is, her spirit never leaves her. and she'll recover from one kind of cancer and then have something else happen to her, and she'll lose her hair, and then she recovers again. But her spirit has never left her. And they have at Broward Health Coral Springs that we have the Lisa Picard Cancer Fund there, and Lisa really leads the efforts to raise money in the community. And in fact, they do an annual event with the city of Coral Springs. This year raised about $30,000 in this run walk that they do. But in addition to that, we are the recipient of an outside group called Glamathon. Glamathon raises money, about $100,000 on an annual basis. It's a not-for-profit organization, and what we do with that, and we're the recipient, the foundation, the Broward Health Foundation is the recipient of the proceeds of those events that they do throughout the year. And a part of it goes to our Lillian Wells Women's Health Center, and the other part goes to Lisa Picard Fund at Coral Springs. So we're underwriting many women who can't afford a mammogram, who need services beyond once they're diagnosed and are recovering. And these funds, kind of at the initiation of Lisa Picard, have really made a huge difference to all those people that they serve throughout the county. So one of the things we're doing, one of the, I won't say weaknesses, but one of the programs that's not at the level that it should be at Coral Springs is their women's health program. So the foundation, again, at behest of Broward Health Coral Springs, we're involved with a project out there. It's a $1.6 million effort to upgrade and create at their Women's Health Center the state-of-the-art technology to be a smaller model, if you will, of what we have at Lillian Wells at Broward Health Medical Center. So it's to bring to that community the highest level of women's health services. Even though they're great now, they're not as good as they could be, and that, in fact, what this fundraising will be. The other thing that you will see in the future at Coral Springs is all of you who live out that way will instantly identify with it. That's where the growth is. In South Florida, the growth is west, and there's a whole series of things as part of the plan for the expansion of Coral Springs. And by the way, the mayor of Coral Springs, Vince Picard, is on our board as well. So
and he is the brother of Lisa.
He's the brother of
right.
Lisa. So what we're looking for, which you will eventually see out in that area, is an expansion of that hospital, because in a day when most hospitals, census is most hospitals aren't nearly at capacity. At Broward Health Coral Springs, almost every day that hospital is over capacity because of the enormous growth, for two reasons. The enormous growth of that area, that region, and secondly, because the increasing understanding of the quality of care delivered at Broward Health Coral Springs. So it's more and more people are using that facility. We also have a number of urgent care centers that refer to Broward Health Coral Springs. So it's increased the use of that hospital. And the guy who runs that, Drew Grossman, is a terrific CEO as well, very committed to the foundation and to working with us. He's like all the CEOs. They're engaged in the life of the foundation and very supportive and very much a vibrant part of who we are and how we interact with our communities.
I am so glad, Dennis, I know you live such a busy life, but that you decided to come here and give people an idea of what the whole hospital world is like, because people don't know, and they may go to an emergency room or have something.
Right.
But you have been really terrific explaining what goes on at every hospital and how it's a heart and soul with a beating heart, right?
Exactly.
And it's really important for people to know that. So if you live in Broward County, you are one lucky citizen, because look what you have going for you, and the foundation's working so hard to raise all the money it possibly can. But now, just explain the Children's Hospital. Right now it's called the Chris Everett
Children's Hospital.
And that does a lot of stuff, doesn't it?
Yeah, it does. We have, we have all the programs that any children's hospital would have. We have pediatric oncology. We have hematology program. We have NICUs. We said that we're level 2 and level 3. We have pediatricians, we have specialties. One of the things that's going to happen in the renovation is that we're creating a outpatient pediatric subspecialty outpatient clinic that will be an extension. Will actually be in the medical office building connected to the hospital there. But again, we're taking a facility that's aged over a long period of time, that has let me say it differently, has very few private rooms, and creating again an environment. All of the rooms will be private rooms. Pediatrics, pediatric cancer, PICU, general surgery, general pediatrics, they'll all be private rooms, as well as the NICU. And we're going to bring this hospital into this century, again, being able to support the work of our nurses and physicians, pediatricians in this case, with an environment that's conducive for healing.
I was just going to say that with all this, with all the bricks and mortar, and I always say that with a lot of things, it's not the bricks and mortar, even though we want to do that. It's what goes on inside. The doctors, all the healthcare personnel, whether you're a janitor, receptionist, whatever you are. These hospitals are so superior to many that you've been in because it's a hands-on organization. I mean, the CEOs really know what's know what's going on in their hospital, and there's a lot of competition between their hospital and their other hospitals in this whole Broward Health. But so now it's going to be, where they're A's, now to be A++ with the bricks and mortar following up with what they created.
From the foundation perspective, Anita, why we like the concept of the system is because it doesn't make any difference if you live in Deerfield Beach or Pompano, or you live in Coral Springs, or you live, by Imperial Point, or you live in Fort Lauderdale proper. One of our hospitals is probably taking care of you. And you can support any one of these hospitals, any one of the programs, and any one of the hospitals. That all makes a difference. The big gifts, the small gifts, they all make a difference. And we're just grateful in the foundation to be in a fortunate position to be the philanthropic arm for an extraordinary system that has a huge impact on the community on a daily basis. We're grateful to be part of that.
Well, and we're grateful to have you, Dennis. We're going to have to chain you to something that you don't leave, because Dennis Stefannaci, President and CEO of the Broward Health Foundation, is one extraordinary human being, and we thank you so much for all you're doing. And we're going to start to have some of the CEOs on our shows now, so you can hear it from them also. So thank you, Dennis.
Oh, thank you, Anita. It's a pleasure to be here. It's always great to talk about you, the foundation board, and the system.